I have a question for you. A 45-year-old patient is admitted to the emergency department following an intentional overdose of a medication she takes for panic attacks. She is lethargic, has slurred speech, and exhibits ataxia. But remarkably, she has no significant respiratory depression. Toxicological screening detects a drug that binds to a specific inhibitory ionotropic receptor, increasing the activation of chloride channel openings. So, which specific receptor is the target of this drug? You will learn the answer to this question after watching this video. Today, we will be talking about GABA receptors of the central nervous system. In the rest of the video, you will see how quickly and easily you can learn these things. That's enough talking. Let's begin. There are two major classes of GABA receptors. These are GABA-A and GABA-B receptors. Historically, a third receptor called GABA-C was described, but today it is considered a specialized subtype of the GABA-A receptor family because of its molecular structure. The two major receptor families differ dramatically in structure, signaling mechanism, speed, and physiological functions. Understanding these differences is fundamental in neuroscience. By the way, did the colors catch your attention? Yes, because these colors have a meaning, and we will learn all about it shortly. Let's talk about the absolute most important inhibitory receptor in the brain, GABA-A receptor. These are ionotropic receptors. An ionotropic receptor is essentially an ion channel that opens immediately after a neurotransmitter binds. When GABA binds to the receptor, the channel opens, allowing chloride ions to enter the neuron. Because chloride carries a negative charge, its influx makes the inside of the neuron more negative. This process is called hyperpolarization. As a result, neuronal firing becomes less likely. Now that we understand the basic structure of the GABA-A receptor, let's take a closer look at its different binding sites. The GABA-A receptor is a pentameric ligand-gated chloride channel, typically composed of 2 alpha subunits, 2 beta subunits, and 1 gamma subunit. One of the most important concepts for the USMLE is that different drugs bind to different interfaces between these subunits. Although they all influence the same receptor, they do not bind to the same location. Let's go through the major binding sites one by one. First, GABA itself binds between the alpha and beta subunits. This is the receptor's primary binding site and directly opens the chloride channel. Benzodiazepines bind at a different site located between the alpha and gamma subunits. They do not activate the receptor directly but enhance the effects of GABA. This mechanism explains why benzodiazepines produce anxiolytic, anticonvulsant, sedative, muscle relaxant, and hypnotic effects. Barbiturates bind to a separate allosteric site on the GABA-A receptor and keep the chloride channel open longer, enhancing inhibitory neurotransmission. So, are you wondering how to remember the GABA-A receptor? It's simple. So, let's set up the equation then. GABA-A equals 4A. Anion channel, acute action, anxiety drugs, anesthesia. Now that we have covered the fast inhibitory actions of GABA-A receptors, let's move on to the second major class of GABA receptors, GABA-B receptors. Unlike GABA-A receptors, GABA-B receptors are metabotropic receptors. This means they are not ion channels themselves. Instead, they belong to the family of G-protein coupled receptors. Rather than producing an immediate effect, GABA-B receptors activate intracellular signaling pathways that ultimately reduce neuronal excitability. As a result, their effects are slower in onset but much longer lasting than those mediated by GABA-A receptors. When GABA binds to a GABA-B receptor, it activates an inhibitory GI protein. This triggers several intracellular events that reduce neuronal excitability. First, the activated GI protein inhibits adenylyl cyclase, the enzyme responsible for converting ATP into cyclic AMP, as cyclic AMP levels decrease, resulting in reduced neuronal activity. GABA-B receptors are located on both presynaptic and postsynaptic neurons. On the presynaptic side, they reduce calcium entry into the nerve terminal. As a result, fewer synaptic vesicles fuse with the membrane and less neurotransmitter is released into the synaptic cleft. On the postsynaptic side, they open potassium channels, causing potassium to leave the neuron. This hyperpolarizes the membrane and makes it more difficult for the neuron to fire an action potential. Because GABA-B receptors act on both sides of the synapse, they reduce neuronal communication through multiple mechanisms simultaneously. So, are you wondering how to remember the GABA-B receptor? It's simple. So let's set up the equation then. GABA-B equals 3B. Break begins slowly, blocks neurotransmitter release. Let's go back to our question. Patient is admitted to the emergency department following an intentional overdose of a medication. She is lethargic, ataxic, and slurring her words, but remarkably, her breathing is mostly fine. Toxicological screening detects a drug that binds to a specific inhibitory ionotropic receptor, increasing the activation of chloride channel openings. So, which specific receptor is the target of this drug? Benzodiazepines target the GABA-A receptor by increasing chloride channel activation, producing strong sedation with a low risk of fatal respiratory depression when taken alone. In contrast, barbiturates act directly, making them much more dangerous and prone to rapidly causing fatal respiratory arrest. And that brings us to the end of today's topic. Now that you have mastered the core functions of GABA receptors, it's time for today's high-yield challenge. If you are ready, here comes today's question. At the GABA-A receptor, which class of drugs increases the frequency of chloride channel opening and which class increases the duration of chloride channel opening? I will be waiting for your answers in the comments. See you later.